you need to ask yourself a question. Do you want to be more relaxed than you are at present, or do you want to be more alert than you are at present when you exit the meditation practice? So let's say you are somebody who is a regular meditator, or let's say you're somebody who's never meditated and you'd like to develop a meditation practice. I suggest that you do a test of whether or not you are more interoceptively dominant or exteroceptively dominant in that moment. So let's say you're on a plane or you're in the car. Stop, close your eyes, and assess whether or not you can access and focus your attention primarily on your internal state, or whether or not your attention and perception gets pulled to something external, to exteroception. And again, that will vary depending on circumstance and who you are. Then I suggest opening your eyes and trying to focus your attention to something external to you and seeing or evaluating the extent to which you can divorce your perception from sensations that occur at the level of your skin or internally. If you sit down, for instance, and you notice that you can equally split your attention between internal sensations and external sensations, or whether or not you find yourself pulled into external sensations when you're trying to focus inward, or you find yourself pulled inward when you're trying to focus outward, well, that will dictate the sort of meditation that you perhaps ought to perform in that moment. Let's say I sit down and I notice that I can really focus inward on what's happening at the level of my skin and my internal organs, and I can rule out everything. Maybe that's because the room is quiet, or maybe it's just because my brain is in a state that I'm particularly good at that moment. Well, then I would opt for a 3-minute meditation practice in which I deliberately exterocept, that I build up the circuitry to focus on something external to me, because I want, and I think most people would like, to have an adaptive mechanism within them so that they can slide along that continuum and they don't default to whatever happens to be easiest for them in that moment. Now, if I were to sit down and try and focus on what's going on internally and I kept getting distracted by things happening outside of me, opening my eyes or feeling like I need to reach for my phone or paying attention to the sounds in the room, well, then I would actively engage a meditation practice, in this case, a 3-minute example, but it could be longer, where I'm deliberately trying to focus my perception on events at the level of the confines of my skin and internally. Why do I say this? Well, if something were easy, if you can perform any activity or thought, etc., well, then there is absolutely zero reason for your neural circuits to change. It's the friction, it's the feeling that something is hard that turns on the enormous variety of mechanisms at the level of cells, etc., that allow you to potentially change your neural circuitry. Challenge and discomfort is the signal to your brain and body that something needs to change. A meditative practice can be made far more effective. That is, it can invoke more neuroplasticity, more shift in brain states and brain circuitry if we do not take the easy path. That is, we go against the grain of what our brain would naturally do in a given moment. So if you're in a crowded airport and you're finding that everything's very distracting, well, then that would be a great time to do some interoceptive focused meditation. Whereas if you are really in your head, you're looping thoughts about the past and present, maybe you're even in obsessive thought, well, that would be a terrific time, an ideal time really, to do a short meditation focused on something external to you. Most people are sort of in their head a lot. They're not really present to what they're doing. Most people have an interoceptive bias. They're focused more on what's going on internally than they are focused on what's happening externally. There's this issue of how long to do a practice. There are a lot of different data on these, but some of the practices we've covered on this podcast before when we had guests, for instance, highlighted the 13-minute meditation that Dr. Wendy Suzuki from New York University's laboratory has popularized, which shows that a daily 13-minute meditation, focus on breathing and focus on that location directly behind one's forehead or both, that meditation done daily for about 8 weeks, maybe shorter, but in that study, 8 weeks, greatly improved mood, improved ability to sleep, improved cognitive ability and focus, memory. A huge number of metrics were looked at. Could you get away with 5 minutes or 3 minutes? Well, my laboratory has shown benefits in stress reduction, improvement in sleep, etc., with a 5-minute a day meditation. However, in trying to establish how long you should meditate, I would ask yourself a couple of questions. First of all, what is a practice that you can do consistently? And by consistently, that doesn't necessarily mean every day. If you answer the question about consistency honestly, and you find that you can only do 1 meditation session per week, well, then I would encourage you to go a little bit longer, maybe 10 or 15 minutes, maybe even 30 minutes. Again, understanding that you're going to have to refocus repeatedly throughout that meditation, regardless of whether or not you're focusing on internal perceptions or external perceptions. If, however, you can set aside 5 or 10 or 15 minutes per day and you can meditate every day, well, then I think you have a little bit more flexibility in terms of how long you meditate. Maybe it's 3 minutes one day, 1 minute the next day, 10 minutes the next, and so on and so forth. Consistency is key. So ask yourself what you can do consistently, and also don't necessarily burden yourself with always having to do the same amount or duration of meditation. Another key component of meditation is the pattern of breathing that you embrace. In fact, the pattern of breathing that you embrace during your meditation practice can itself be its own form of meditation. More typically, a meditation practice involves slowing one's breathing, and this could be in the form of cyclic breathing of inhale, exhale, which is cyclic, or in some cases, doubling up on inhales and then exhaling. So inhale, inhale, exhale, exhale, or controlling the duration of inhale, breath hold, exhale, breath hold, repeat, so-called box breathing, where the inhale, the hold, the exhale, and the hold are of equivalent durations. So that raises the question, how should we breathe during meditation? Well, there's, again, no simple one-size-fits-all rule there, but there are some general rules of respiration physiology that can help us access and develop a meditation practice that is going to best serve our goals. You need to ask yourself a question. Do you want to be more relaxed than you are at present? Or do you want to be more alert than you are at present when you exit the meditation practice? Do you want to calm down or do you want to become more alert? Simple question. You can decide from session to session. You could even switch within a session. But just as you need to assess whether or not you are leaning more interoceptively or exteroceptively, you also need to ask yourself, do you need to calm down or want to calm down, or do you want to be more alert at the end of your meditation session? Or maybe you want to go into a state of deep relaxation and then exit with more alertness. The way to do that is very simple, using breath work and specific patterns of breathing. And here is the general rule that is supported by all the respiration physiology that I'm aware of. Essentially, if your inhales are longer and or more vigorous than your exhales, then you will tend to be more alert, or you'll shift your brain and body towards a state of more alertness. This is simply based on the way that the neural circuits, simply the way they work. They communicate with brain areas that release noradrenaline, norepinephrine, etc. In contrast, if you emphasize longer duration and or more vigorous exhales relative to your inhales, you will tend to relax more. You will tend to calm your nervous system. Now you might be saying, okay, I understand what it is to make an inhale longer than my exhale, but how do I make it more vigorous? Well, it simply means drawing more air into your lungs more quickly than you allow yourself to exhale that air. So an example of inhale-biased breath work would be, so there's an active emphasis on the inhale, and it's a little bit longer than the exhale, which is passive. Conversely, if you want to relax, then you want to extend your exhales relative to your inhales, and you can even make them active exhales. So it can be inhale, exhale. That's going to shift your nervous system in a direction of more calm. And of course, if you would like to stay at the level of alertness, aka calmness, because those are two sides of the same seesaw or the same continuum, if you'd like to be right where you're at the end of your meditation as where you started, at least in terms of levels of alertness and calmness, well, then you would just keep your inhales and your exhales relatively balanced in terms of duration.